Hi everybody, Dr. Sean Casey here with Healthcare Complete, answering your questions. We had a few folks send in a question we see quite often, which is, Doc, I see all these nutrition programs, diet programs out there. What's right, what's accurate, what's the best way to eat? There's a lot of different good programs out there, but the basic guidelines I push patients toward is something called the anti-inflammatory diet, which you've probably seen under different names for years. Essentially, when you hear the term inflammation, people are familiar with that these days, causing a lot of issues and problems. And actually, research shows that inflammation is the major cause of cancer, heart disease, diabetes. It's this long-term wear and tear on cells and tissues caused by acids in our diet. You also might have heard about your system's too acidic or your pH is off, are inflamed. All the same thing. Basically, certain foods we eat produce acids as a byproduct. Even though there's some good nutrients there, those acids can beat our systems up pretty bad. So I usually recommend looking at the anti-inflammatory diet. So what is that? Guarantee you've heard about it. Any food we associate with food allergens typically is going to be pro-inflammatory. So whether you have a specific food allergen or not, it still impacts us and creates inflammation, which overall damages our health. So essentially, we're avoiding sugar, which we know about, additives, preservatives, chemicals, extra gluten-y foods. Gluten's not terrible, but the quantities we have in most of our foods these days is way too high, and that's a protein we have a hard time digesting, and that creates inflammation as well. The other big one that's kind of surprising is starchy foods. Basically, a starchy food is a food that as soon as we start to digest, turns into sugar. So that's classically your potato, corn, and peas. Now, here's the thing. Just because you're eating healthy doesn't mean it has to be terrible. It should have lots of flavor, lots of taste. There's a lot of great substitutes out there. We kind of guide our patients through the different nutritional programs that we do in our office. One's the Chirothin program, some other anti-inflammatory programs to get healthy again. So if you have any questions, you want to get more in depth on it, we were happy to help out. Give us a call. We'll be happy to talk. Have a great day.